And now please welcome with me to the stage Mr. Chuck Fosh and Mr. Arini Johnson, representing the Chief of Staff of the Mayor and the Administrative Assistant of the Mayor Bell, to give some remarks.
Good morning.
Good morning.
Well, the mayor thought it well enough that he sent two of us. Thank you so much for being here on this morning. I had a conversation outside just before it started, and I am just reminded of something that is most important, and that's people. Oftentimes we put brick and mortar in front of flesh and blood, and so as you talk and you move about and suggestions and advice and things that come about out of this day, we wish you much success. And just know that Mayor William Bell and everyone in the city of Birmingham is thankful for you being here, and we look forward to a great day and a great summit. And Madam President, thank you for the Shining Star, UAB, hosting this event. Thank you so much, Mr. Johnson.
Good morning. I'm privileged to join and bring greetings on behalf of the Honorable Mayor William Bell and the City of Birmingham this morning. The City of Birmingham is honored to take part and support the initiative of the REACH USA Health, Economic, and Development Summit. Although health has improved throughout this country in recent years, the overall population still remains widespread, and the disparities that has occurred in the minority communities is alarming, to be mild. Birmingham is pleased to join forces with the REACH Mid-South Seed and try to bridge this gap that has occurred and trying to find solutions to these problems that exist in the minority communities. Again, I'm honored to be here and commend the Minority Healthcare Disparities Center and the Comprehensive Cancer Center and the American Cancer Society and the CDC and other partners for your efforts in trying to find a solution to these problems. The mayor, again, sends his well wishes and is honored to be here with you. Thank you.
And good morning again. For those of you who do not know me, I am Carol Garrison, and I am president of UAB. As everyone who has come before me, I too am delighted to welcome you not only to this event, but particularly to our campus. Clearly today, this is going to be a very important opportunity to improve the health and the economy of our region, and ultimately, I think, our nation as well. You've already heard from the region preceded me that the state of the economy and the health of the population often mirror each other. And as an epidemiologist, I know that only too well. So your task today is to find creative ways to change both of them for the better. Here in the South, some might say the Deep South, we see very high mortality rates across a host of diseases. And so this is going to be a pretty big task. But together, as I look around the room and have looked at those of you who have been invited and who have come today, I realize that you really form a distinguished panel of experts representing pivotal organizations from around the country. I believe the collective knowledge is actually in this room to be the key to success in this endeavor. Now, UAB from its very beginnings has been an intensely collaborative organization, culture, with many different schools, departments, and centers coming together to address important challenges in our community, in our state, in the areas of healthcare, education, economic development, just to name a few. That collaborative spirit reaches far beyond this campus to our local and state governments, and I think you've just seen that with two representatives of the mayor here this morning. It also extends to the national level. The expertise that you bring to this summit is of the highest caliber. We look forward to your insight and your ideas as we investigate the driving forces behind improved healthcare and education and sustainable economic development. Now, we have a good deal of success to build on. You all have a good deal of success to build on. I want to commend Dr. Fuad and Dr. Partridge and all of the partners that are here for what we've learned and accomplished already through the effectiveness of our community-based programs throughout the state and particularly in the Black Belt region. They are truly models. We've seen the impact of partnership at the grassroots level, training a host of community health advisors. and empowering communities to improve health, education, and and to narrow the disparities across all groups. I know at this summit we will build upon the accomplishments and develop economic development models and healthcare strategies that reverse current health trends and enhance economic growth. Your collaborations, both today and through the working groups that I think will be formed today and hopefully move forward into the future, will lead that innovative research and will also result in a healthier, more educated workforce and a higher quality of life for all. UAB is honored to host this group and honored to serve as a catalyst for this event. We are very grateful for your presence and for your partnership in bringing better health, education, and economic opportunity to underserved areas. Thank you very much.
Thank you, Dr. Garrison. I really appreciate the support of our leadership at UAB that we have, and without the support of our leadership, we wouldn't have been able to do all the things that we're doing and be effective in the community.